Good day, fellow learners. Once again, this is your mentor, your fact check buddy, Gapuz, joining you for another day of tips and pointers for the next generation NCLEX RN. I hope you are enjoying our videos. If you may want to browse through our video collections, including my collections of quick fix sessions in the past, please feel free to scroll down our channel and get those videos working for you. So before we get to start, I'd like to tell everyone that this is our next generation NCLEX RN pointers session number 9. So if you want to join our hundreds and thousands of passers from all around the world, give us a text or call at 0906-201-9383 or email info@ragapusreview.com. From among all of those passers, let me share with you the experience of Maria Aliza Reblora, USRN. She passed the Texas Board of Nursing Next Generation NCLEX RN test last May 19, 2023. That's just a couple of days ago, because I think today is just May 22. So she just took it last Friday. So here we go. She sent me an email and she says, "Dear Sir Ray, how are you? I'm one of your students from the NCLEX Quick Fix held last April and May. I was one of the 2 students you mentored last Thursday at Gapuz office. I just took my exam last Friday and was still in shock, so I wasn't able to send a message to you afterwards. I thought about writing to you after I received at least my quick result, but now I just realized the cons of taking the exam on a Friday. I have to wait for a few more days for the quick results. Anyway, my friend who is a Gapuz baby convinced me to send you a message the soonest possible time. I would like to let you know that I am so grateful for your mentorship. Almost everything you discuss in our quick fix sessions appeared on my exam." This email she sent, and she has yet to receive her result when she made this. The pointers, the last pointers you gave us last Thursday, I studied it all as much as I could during the wee hours in the morning because I was too nervous to sleep. Most of it appeared in my exam. Wow, I'm having goosebumps. I was cramming, but it was a good cramming, I guess. Totoo pala, sir, naririnig ko boses mo while I was taking the exam. So she's saying it's as if she's hearing my voice while she's taking the exam. I was in the exam for like 10 minutes and I was on my 8th item when I heard yung bilin mo na go slow. And so I did, okay? So she remembered what I always tell them, go slow. I was so nervous that my hands were cold and trembling. I took deep breath and exhaled per sleep breathing style, laughing out loud. I slowed down my pace. I ended my exam at 85 items. My PC shut off. I almost forgot that there was a survey after. So I hastily raised my hand when I realized this. My fear was that the traditional questions and the dreaded SATA. Funny is that my first question was a SATA. I think I got a lot of SATA, and like every 7 or 8 items, it is there. I also got a lot of case studies, some 6 items, while others are standalone items. I answered it all carefully. Take note. Following your test-taking strategies, I do hope I pass. I will hang on while waiting. But look, this is the next email she sent, and that was just at 8:37 a.m. today. And she said, "Just an update, Sir Ray, I passed. I just received my quick results this morning. I'm forever grateful to you and to all your mentors, our mentors. Please extend my thanks to all of your staff also for accommodating us. I really love how you handled our review sessions. I learned a lot from all of you. I am recommending your review center to all my colleagues. Mabuhay ka, Sir Ray. You're such an inspiration to me. God bless you, sir. Forever thankful, Alisa, USRN." And I said, wow, God is so good. Congratulations, to God be the glory. And that is all for him. Okay, now, what are the things that we have to learn from Alisa? Number 1, she followed our course shell. And take note, the most important thing that you have to remember is what are the things that you need to study. Now, these are the pointers that I'm going to discuss in this video. Let's begin. The impaired nurse. Of course, when you say the impaired nurse, An impaired nurse is a nurse who is unable to meet the requirements of the Code of Ethics and Standards of Practice of the profession and has cognitive, interpersonal, or psychomotor skills affected by two important things to note: psychiatric illness and or drug or alcohol abuse and addiction. So which means an impaired nurse could be a nurse who is suffering from psychosis. An impaired nurse could be a nurse who's suffering from a debilitating anxiety disorder, like, for example, obsessive compulsive disorder, or a nurse who is a substance abuser, specifically an alcoholic, or someone who uses drugs. Okay, that's the reason why impaired nurses would usually have the closed door syndrome, which means they engage in a lot of break, like pee break, poo break, smoking break. They invent all types of reasons for them to go on a break. And sometimes they inject themselves not here on the upper extremities, but in between their toes, because nobody would check on your toes, okay? On their toes rather. So therefore, an impaired nurse is characterized by, we have the code impaired, inappropriate clothing. Sometimes even if they're already at home, they still wear their scrub suits. They are having mood swings, meaning they easily get irritated, preoccupation with death and illness, and they have very, very unprofessional conduct. Common example would be absenteeism at work. Increased personal phone time because they transact business over the phone. They have rigidity. They are unable to change plans. They have exaggerated self-importance, and they have difficulty in remembering procedures and instructions. You would know that you have an impaired colleague in your unit if you have a lot of instances in which your patients who are supposed to be receiving pain medications post-surgery are complaining of very, very severe pain. And yet, if you check their medication administration record, it says there that their pain medication has been given on time. Suspect that it could be an impaired nurse who has given them just placebo, and they took the patient's medications like narcotics and injected it to themselves. So that's an indication when there's a lot of complaints related to pain coming from patients who should be given pain medications after surgery, and yet the medication record says that their pain medications have been given. Suspect that you have an impaired nurse if these things happen in your unit. Okay, second is domestic violence. This is also known as intimate partner violence. So this is cyclic in nature, which means there's a pattern of behavior that occurs in a relationship. And this is done for two things. The abuser wants to gain and maintain power and to gain and maintain control. Now remember, abuse comes in different forms. There are 5 common types. Remember the code PIPS. P, physical, E, emotional, E, economic, P, psychological, and S, sexual. Okay, so let's dig deep. The 2 most apparent would be physical because of the physical manifestations, and sexual. Okay, how would you know that your partner is abusing you physically? So ask yourself, is he hurting me? So is your partner hurting you? Is your partner using a weapon to inflict pain on your body? Is your partner hitting you? Is your partner biting you? Is your partner burning you? So all of these things that they are doing to inflict physical pain is a form of domestic violence. Now, what about emotional abuse? How would you know that your partner is emotionally abusing you? So does your partner embarrass you in front of other people? Does your partner shout out you? Does your partner verbally abuses you? Do they undermine your accomplishments and achievement? They don't want to acknowledge your achievements. That's a form of emotional abuse. What about economic abuse? Does your partner make you too dependent on them controlling the finances? Or does your partner squander your resources or your money? Or does your partner not allow you to spend money which you have earned? Okay, that's economic abuse. Now, psychological abuse comes in the form of your partner making you feel that your decision is not worthy enough. So which means they make you feel like you're unable to make the right decision. That's a form of psychological abuse. And what about sexual abuse? Well, when your partner pressure you to engage in sex, or when they accuse you of cheating, or when they accuse you of having a boyfriend or a girlfriend on the side, or when they hold you down too tight during sex, or when they demand sex even if you are ill, that's a form of sexual abuse. Now, take note. What should be your priorities? Remember your LBC. Okay? First, listen. Then B, believe the victim. Listen to the victim, believe the victim, and C, call the appropriate authorities. So it's very important for you to give the victim the phone number of temporary shelter, because sometimes the problem of the victim would be, where will I go if I decide to leave my husband? So provide them with phone numbers of support groups, temporary shelter where they can go. And the most important thing is plan their safety, okay? So, and this includes digital safety. What does that mean? Well, instruct the patient to have a separate email, and then do not immediately delete your internet history if you're a victim of domestic violence, because that will alert the abuser, okay? Now, remember, text messaging is not a safe thing to do when you're dealing with an abuser. So call instead of using the text, and take note, use a computer that the abusive partner doesn't know about. That's the most important thing. Do not use a common gadget, because most abusers are very controlling. They want you to just use the same Facebook account that they have, the same messenger account as they have, okay? Next, should you decide to leave your abusive partner, what are the things that you have to ensure? First, you have to have a post office box in your name, your PO box, and then you open a separate bank account and credit card in your name. Then you have to change locks if your abusive partner is familiar with where you're supposed to be going to. Tell friends and neighbors that your abuser is not living with you anymore, but don't go into detail. Don't share the details of the abusive relationship. Just tell them that the abuser is no longer living with you anymore. And then ask a friend or another person to screen the calls for you. So that simply means your phone should have a call divert feature, so that when somebody calls, it goes to another person. They can validate it before telling you, notifying you that you need to call a number for a specific concern. But make sure that the person screening your call knows the real score. And then keep documents in a hiding place, and that could be done at home, or better yet, in a separate area near the house of a friend, or even in the vault in the bank, possibly. Those things are the ones that you have to consider when you are dealing with domestic violence. The priority definitely would be ensuring your safety, both physically and digitally. Next, okay, remember, domestic violence is a cyclic phenomenon. So do not believe when your abusive partner eventually would kneel before you and beg you to come back. No, never again. Do not put yourself into the abusive relationship twice, okay? It's a cycle. They will not stop. That's the kind of love expression that they were brought up to. That's why they think that's the right way of loving a person, which is very abusive. Next, toxoplasmosis. Now take note that this is a parasitic infection. Toxoplasmosis is caused by your Toxoplasma gondii, which is a parasite. The difference between a parasite and a virus and bacteria would be, your virus and bacteria can survive even outside the body. The parasite depends on your body to survive, okay? So toxoplasmosis is initially asymptomatic, and then eventually when the patient develops symptoms, this could last for approximately 3 to 4 weeks. And that begins with, since this is an infection, begins with fever, then swollen glands or lymphadenopathy, and of course, muscle aches. Now, the most important thing that you have to remember for your test is, what's the common mode of transmission? One would be cleaning the cat litter box, okay? And this is not a good idea for pregnant patients, or eating half-cooked meat. Therefore, avoid exposing yourself to the cat litter box, where usually your toxoplasma is excreted by your cats. And then you will need to cook your meat properly, and that simply means the temperature should be at least 60 to 70 degrees centigrade, okay? 60 to 70 degrees centigrade, and you make sure that the water that you're drinking is boiled. And take note, the treatment would usually involve the administration of antibiotics like pyrimethamine, okay? Pyrimethamine is the most effective drug for toxoplasmosis. And sometimes your pyrimethamine is administered with leucovorin, which is your folinic acid. Now take note, your leucovorin will help prevent bone marrow suppression that could be associated with your antibiotic, pyrimethamine, okay? So the most important thing, therefore, that you have to remember about toxoplasmosis is how to prevent it. And that should form your discharge instruction to your patients, okay? Now, remember, toxoplasmosis is transmitted to humans through cleaning cat litter boxes or ingestion of half-cooked meat. So you will have to instruct your patient to avoid these activities. The functional concepts are really, really very useful as a teaching and learning method, okay? So second, you have to know how to study by using technology. Here at the Ray Gapuz system, we have world-class publications published by well-known publishing companies like Mosby's and Jones and Bartlett USA. And of course, the latest technological advancement that we have at the Ray Gapuz system, the secret tool of all our next generation NCLEX RN passers, we have the Ray A. Gapuz system core shells that deals with all the subject matters on the NCLEX, safety and infection control, basic care and comfort, health promotion and maintenance, management of care, physiological adaptation 1, 2, and 3, reduction of risk potential, and psychosocial integrity. And the third secret to passing the test is actually to be in a conducive environment, which means the environment should keep your focus. Like how we do it. We have our own NCLEX simulation room that you can use anytime you want, having the same experience like the actual exam. That's the key to do it. And of course, our very, very intimate classes done in conducive environment. So let me invite you to engage in our next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. Your choice of live face-to-face class, virtual class, on-demand and limited video recorded lessons, the Q-Bank, 3 books, Next Generation Strategies and Sample Questions by Dr. Gapuz, that's me, okay? And of course, the 24 hours, 3 days quick fix sessions. The fee starts at $3,499 to inquire for either a morning weekday class or an afternoon weekday class, or even a weekend class. All of these classes are available for you. Give us a call at 0906-201-9383. Once again, this is your mentor, your fact check buddy, Ray Gapuz, joining you in this pointers and tips video. Till my next video, remember, a functional concept a day keeps your NCLEX RN fears away.